Ricardo Alonso-Zaldivar is a health and science reporter for the Associated Press, and he joins me now from Washington. Thank you so much for joining us, Ricardo. Listen, you're probably one of the few people who have done what the Republicans have asked many people to do, which is head to the website and read this bill. A lot of critics, or some critics at least, have called it Obamacare light. I want to ask you, break it down for me and tell me, why has it earned that moniker from some anyways?
Well, healthcare is very complicated, and it's easy to put labels on one thing or another. But really what's important is for people to take a look at the details and the workings of anything that's proposed and try to figure out how it would work in the real world. You can call something Obamacare light. Well, it maintains some parts of the Affordable Care Act that are popular with the public, tax credits to help people buy health insurance, protection for people with pre-existing condition done in a different way, and also things like keeping your kids on your health plan until they turn 26. But the important thing is not to get fixed on the labels that people use in debate, but to actually look at what's being proposed and try to think about how it would fit into your life.
Yeah, that's the thing about this bill, and probably any healthcare bill, is that it is so complicated. It's very difficult to see what the unintended consequences might be, particularly with this bill. We don't even know how much it's going to cost yet. Still, in light of that, the more conservative critics say it just doesn't change enough. It's not far enough away from Obamacare. What do you think could be done to change this bill to win over conservatives?
That's a very good question, and to be frank with you, it's unclear. The backdrop to this is that there is a big debate going on in our country, a very passionate debate about the role of the government in health care. Many conservatives believe that the government should not really be as involved as it is now. And so what this bill does is limit the role of government in health care, dial it back some, but the government still remains a major player. Medicare, Medicaid, and the Affordable Care Act, those programs together cover about 130 million people. So you just can't dial that switch back very quickly without causing a lot of disruption. So what we're seeing here is a change at the margins, but it's unclear right now whether conservatives will be satisfied with that, or whether they will insist on going for something that's much deeper. But there is a lot of significant change in this bill.
One of the changes seems to be, or at least that's what some of the architects of the bill seem to be focusing on, is that it is dialing back federal involvement, but shifting more responsibility to the state, allowing states to figure out how they want to divvy up the money and who they want to spend more money on. That seems like something every conservative could get behind.
Right. And it's not just the states, but it's also individuals, because in this bill there are provisions for expanding health savings accounts, and there are provisions for deregulating the market for private health insurance, individually purchased to some degree, not totally, but to give individual consumers more options. Now, the issue with health care is it's very expensive, and there's no way around that. It costs a lot of money. The amount of money it costs goes up faster than our wages, faster than the rate of inflation every year. So the concern about this bill, and this is now not from the conservatives but from others, is that if you take the federal money out, then what happens? If you dial back the federal money, then what happens? And particularly to people of modest means, low-income people, poor people who can't really afford private health insurance.
Right, indeed. At the end of the day, those people who have Obamacare but voted for Donald Trump, their biggest complaint was they have health insurance, but they can't afford to use it. And we really won't know whether or not this piece of legislation, this alternative, is a winner until we really know what people will be paying. Ricardo Alonso-Zaldivar of the Associated Press, thank you so much for joining us.
Thank you, Anne Marie.